What if I told you that some cases of depression, anxiety, even bipolar symptoms might not begin in the brain at Albert on your plate? Imagine sitting in a doctor's office and hearing this question. What if changing how you eat could change how your mind feels? That idea sounds almost too simple, yet it's quietly shaking the foundations of modern psychiatry. Let's slow down and really explore this, because according to doctors like Dr. Matt Bernstein, nutrition is no longer just about weight or heart health. It may be one of the missing keys to understanding mental illness itself. For decades, psychiatry has focused mainly on brain chemistry, but low serotonin, imbalanced dopamine, faulty neurotransmitters. So we prescribe medications designed to adjust those chemicals. And for many people, these medications are life-saving. That matters. This is not about rejecting psychiatry, but here's the uncomfortable truth many doctors are now facing. A large number of patients don't fully get better. Some improve a little, some not at all. Others struggle with side effects. And many keep asking the same question year after year. Why do I still feel this way? This is where nutrition enters the conversation, not as an alternative, but as a missing layer. Dr. Matt Bernstein explains that the brain is the most energy-demanding organ in the body. It uses more nutrients, more oxygen, and more metabolic fuel than almost any other organ. Yet, for a long time, we've treated mental illness as if the brain exists separately from the rest of the body. But the brain is made of cells. Cells need nutrients. And if the body is inflamed, insulin-resistant, deficient, or metabolically stressed, the brain feels it first. One of the biggest shifts in modern psychiatry is the understanding that mental health and metabolic health are deeply connected. Let's talk about inflammation. Chronic inflammation doesn't just cause joint pain or heart disease. It also affects the brain. Inflammatory chemicals can cross into brain tissue and interfere with neurotransmitters. Studies consistently show that people with depression, anxiety, and schizophrenia often have higher levels of inflammatory markers in their blood. Now, here's the key point. Dr. Bernstein emphasizes, food is one of the strongest drivers of chronic inflammation. Highly processed foods, refined sugars, industrial seed oils, and constant blood sugar spikes send inflammatory signals throughout the body. Over time, the brain lives in that inflammatory environment. Mood becomes unstable. Motivation drops. Anxiety rises. Focus fades. This is not psychological weakness. It's biology. Another major concept is blood sugar. When blood sugar rises and crashes repeatedly, something very common in modern diets, the brain experiences it as stress. Low blood sugar triggers adrenaline and cortisol that can feel exactly like anxiety, racing heart, nervousness, irritability, panic. Many people diagnosed with anxiety disorders are actually living on a blood sugar roller coaster. When nutrition stabilizes blood sugar, symptoms often reduce, not because the person tries harder, but because the brain is finally getting steady. Fuel Dr. Bernstein also talks about nutrient deficiencies that are shockingly common in psychiatric patients. Magnesium, zinc, omega-3 fatty acids, B vitamins, iron. These are not supplements for wellness influencers. These nutrients are essential for neurotransmitter production, nerve signaling, and brain repair. For example, serotonin doesn't magically appear. It's made from amino acids and requires specific vitamins and minerals to be produced properly. If the raw materials are missing, no amount of positive thinking will fix that. This brings us to a revolutionary idea in psychiatry. Food is information. Every meal sends chemical signals to the brain. It tells the brain whether the environment is safe or stressful, abundant or scarce. Over time, those signals shape mood, resilience, and emotional stability. Dr. Bernstein explains that this doesn't mean nutrition cures mental illness overnight, but it can dramatically change the baseline from which the brain operates. And for some people, that shift is life-changing. Now, let's address the skepticism, because it's fair. People often say, if nutrition mattered so much, why didn't my psychiatrist talk about it? The answer is simple and uncomfortable. Medical training historically included very little nutrition education. Psychiatry especially focused on diagnosis and medication management. The system was never designed to look deeply at food, but that system is changing. We are now seeing the rise of nutritional psychiatry, metabolic psychiatry, and integrative mental health. These fields don't reject medication. They ask a better question. What does the brain need to heal? Now, let's go deeper into what this actually looks like in real life. Because once you accept that nutrition affects the brain, the next question is obvious. What kind of nutrition are we talking about? Dr. Matt Bernstein often explains that the modern human diet is biologically new but neurologically expensive. Our brains evolved on whole, nutrient-dense foods: fish, eggs, vegetables, fruits, nuts, and natural fats. But today, a large percentage of calories come from ultra-processed foods designed to be cheap, addictive, and shelf-stable, not brain support. One of the most powerful dietary shifts being explored in psychiatry right now is the move away from ultra-processed carbohydrates and toward more stable, nutrient-dense fuel. Let's start with protein. Protein provides amino acids, which are the building blocks of neurotransmitters. Dopamine, serotonin, norepinephrine, these chemicals that regulate motivation, pleasure, focus, and calm, all made from amino acids that come from food. When protein intake is low or inconsistent, the brain struggles to maintain emotional balance. Many patients with depression or anxiety unknowingly eat diets that are high in sugar and refined carbs but low in quality protein. When protein intake improves, mood stability often improves with it, not because of belief, but because the brain finally has the raw materials it needs. Then there's fat, which has been deeply misunderstood. The brain is nearly 60% fat. Healthy fats are essential for brain cell membranes, communication between neurons, and reducing inflammation. But omega-3 fatty acids, especially EPA and DHA found in fish, play a direct role in reducing depressive symptoms in many people. In fact, some studies show omega-3 south can be as effective as antidepressants for certain individuals with mild to moderate depression. Dr. Bernstein also talks about metabolic health as a central pillar of mental health. Conditions like insulin resistance, prediabetes, and metabolic syndrome don't just affect the body, they directly impact the brain. When the brain becomes insulin resistant, it struggles to use glucose efficiently. This creates brain fog, fatigue, low motivation, and emotional instability. This is why some patients with severe treatment-resistant mental illness have shown improvement on diets that stabilize metabolism, including low-carbohydrate or ketogenic approaches under medical supervision. These diets change how the brain gets energy, shifting it from unstable glucose spikes to more consistent fuel sources. This doesn't mean everyone needs a strict diet, but it highlights something critical. The brain cares deeply about metabolic stability. Now, let's talk about the gut, because this is where psychiatry and nutrition truly intersect. The gut and brain are in constant communication through the vagus nerve, immune system, and chemical messengers. About 90% of serotonin is produced in the gut, not the brain. When gut health is compromised due to poor diet, chronic stress, antibiotics, or inflammation, mental health often follows. Ultra-processed foods disrupt the gut microbiome. Fiber-poor, sugar-heavy diets reduce beneficial bacteria and increase inflammatory species. This imbalance can increase anxiety, depressive symptoms, and even cognitive dysfunction. When nutrition improves, the gut environment changes. Inflammation decreases. Neurotransmitter signaling improves. The brain receives clearer, calmer signals. Dr. Bernstein emphasizes that this is not placebo. Brain scans, blood markers, and clinical outcomes increasingly support these connections. Another crucial point is micronutrient density. Modern diets can be high in calories but low in nutrients. Someone can eat all day and still be deficient in magnesium, zinc, iron, or B vitamins, nutrients directly linked to mood regulation and stress resilience. Correcting these deficiencies can significantly reduce symptoms in some patients. What's powerful here is not that nutrition replaces psychiatry, but that it expands it. Instead of asking only, "What diagnosis is this?" doctors are beginning to ask, "What is driving this person's brain dysfunction? Is it inflammation, blood sugar instability, nutrient deficiency, gut imbalance, metabolic stress?" These are medical questions, not lifestyle judgments. Now, let's step back and look at the bigger picture, because this is where the conversation becomes truly transformative, not just for individual patients, but for psychiatry as a whole. Dr. Matt Bernstein makes a careful but powerful point. Nutrition does not replace psychiatry, but it changes the foundation on which psychiatry stands. For over a century, mental illness has been framed mostly as a chemical imbalance or a psychological disorder. That framework led to important treatments, especially medications and therapy. But it also unintentionally separated the brain from the body. What nutritional and metabolic psychiatry is showing us is this. Many mental illnesses are also disorders of brain energy, inflammation, and cellular function. When the brain is underfueled, inflamed, insulin resistant, or nutrient deficient, it cannot regulate mood, perception, or emotion properly. Medication can help manage symptoms, but if the underlying biological stress remains, recovery is often partial. This is why Dr. Bernstein and others describe nutrition as a lever, not a magic cure, but a lever that can shift the entire system. One of the most exciting and controversial areas is the use of metabolic interventions in severe mental illness. Conditions like bipolar disorder and schizophrenia were once thought to be completely unrelated to metabolism. Yet research now shows strong links between these conditions and insulin resistance, mitochondrial dysfunction, and chronic inflammation. In some clinical cases, improving metabolic health has led to reduced symptom severity, improved clarity of thought, and even reduced medication needs always under medical supervision. These outcomes challenge long-held assumptions about what mental illness is and how flexible the brain truly is. But Dr. Bernstein is also very clear about the limits. Nutrition is not a quick fix. It requires consistency, personalization, and time. Not every patient responds the same way. Trauma, genetics, social stress, and life circumstances all matter deeply. Food alone cannot solve everything. And there's another important truth. Changing diet is harder than taking a pill. It requires support, education, and compassion, not blame. Many patients are already exhausted. Any nutritional approach must meet people where they are, not overwhelm them. Still, the implications are enormous. If nutrition becomes a standard part of psychiatric care, the questions doctors ask will change. Appointments won't just focus on symptoms, they'll explore sleep, energy, blood sugar patterns, inflammation, and nutrient intake. Mental health treatment becomes more preventive, more holistic, and more humane. This shift also reduces stigma. When people understand that their depression or anxiety has biological drivers beyond weakness or faulty thinking, shame decreases. Hope increases. Healing becomes possible. Perhaps the most radical idea Dr. Bernstein puts forward is this: mental illness is not always a lifelong sentence. In some cases, it is a signaling alarm that the brain is under metabolic or nutritional stress. And when that stress is addressed, the brain can change. So can nutrition transform the field of psychiatry, not by replacing therapy, not by rejecting medication, but by finally giving the brain what it needs to function. This isn't about food trends, it's about biology. And once you see mental health through that lens, psychiatry may never look the same again. Nutrition will not solve every mental health condition. It won't erase trauma, rewrite genetics, or replace skilled therapy and medication when they are truly needed. But what it can do, and what Dr. Matt Bernstein so powerfully explains, is change the ground on which mental health stands. For too long, psychiatry has tried to heal the mind while often ignoring the body that feeds it. The emerging science now shows us that the brain is not isolated. It responds to inflammation, blood sugar swings, nutrient shortages, and metabolic stress with real symptoms: depression, anxiety, mood instability, brain fog, even psychosis in some cases. When nutrition improves, the brain's environment improves. And when the brain's environment improves, healing becomes possible, sometimes partially, sometimes dramatically. This doesn't mean food is a cure. It means food is a foundation that can make medications work better, a foundation that can reduce symptom severity, a foundation that can restore hope where people were told to expect lifelong illness. Perhaps the most important transformation nutrition brings to psychiatry is this: it gives patients agency without blame. It replaces shame with understanding. It turns the question from "what's wrong with me" into "what does my brain need?" And that shift, quiet, scientific, and deeply human, may be one of the most important evolutions psychiatry has ever seen.